I think you should choose Roberts for a number of reasons. We do really interesting high-tech things in our simulation lab and in our skills lab that are real-life situations. We have I think, a holistic view of how we treat patients. Faculty that everyone does something outside of teaching. They all work as nurses, so we can bring real stories and real cases of patients that we've taken care of to the students and let them know, what care is happening right now in different areas. Whenever I talk to a prospective student and their parents, usually, I'll ask two questions. Why nursing? And usually it's they want to help people. They want to contribute to making people better. They want to learn a holistic nursing program. And then the second question is, why Roberts for nursing? And overwhelmingly, the last several students that I've spoken to have told me because you have a reputation as a really good school of nursing. And I really wanted the Christian aspect of it. Our pediatric students, we teach them spiritual assessment and how to integrate that into their care. We will oftentimes have a devotion before class. We'll oftentimes say a quick prayer for our students before tests, and we try to integrate it as much as we can. I would want a new student to know that the nursing faculty is here for them, and we're here to help them through their program. We know that it's a difficult, rigorous program, and we are here to help. By far, my favorite class to teach is our Nursing 4700, which is Pediatric Health Concepts. My background is primarily pediatrics. I've worked in pediatrics for about 30 years and have really appreciate teaching that course. In that class, we have 2 lectures a week. We do a fair amount of case studies in that class as well to get the students involved in real life situations. We also have simulation as part of that course, where we go to our simulation lab and have one of our pediatric mannequins set up to have a clinical problem that the students have to address. We've really tried to integrate clinical judgment into our classes, at least our junior and senior clinical courses. And the clinical judgment model really has them looking at recognizing cues, analyzing cues, determining what the priorities are, evaluating it or implementing it, and then evaluating it. And it's really, I think, helped them to come out of school feeling more confident. At the end of the senior year, the students do what we call an interprofessional education simulation. And as part of that simulation, for the last couple years, since I've been here, we integrate our friends from Mercy Flight Central, and they come and they take a patient away. They don't do it with the helicopter itself. They have a fairly high-tech helicopter simulator that they bring with them, and we roll that in, and they come in, they take care of the patient, and we're transferring that patient out of our hospital to somewhere else.